Good afternoon, everyone. Thanks so much for joining us for this, our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry L. Demings will discuss our goals for the week, details on a gubernatorial executive order, and an update on opportunities for vaccinations taking place here in Orange County. Mayor Demings will also discuss the launch of our program to help renters that are in need and the work of our strike team and other details as well. Orlando Mayor Buddy Dyer is here to discuss rental assistance and other items COVID-related in the city of Orlando. Dr. Raul Pina from the Florida Department of Health is also here to discuss positivity rates, testing, and vaccination details. We begin this press conference with Mayor Demings. Mayor?
Good afternoon. Thank you all for joining us. It has been 1 year this month since the COVID-19 pandemic transformed our lives. We immediately started holding weekly COVID-19 news conferences and have done so right up until today, where we are holding our 113th briefing. It was March the 13th when I signed an executive order declaring a local state of emergency. At one of our first news conferences on March the 2nd, we had 0 cases in Orange County and only 4 cases in the state of Florida. At that time, I assured residents that we would keep them fully informed on what we were doing to keep them safe. I also emphasized that the coronavirus moved at a fast pace and we would remain calm and work closely with our partners at the Florida Department of Health, primarily Dr. Raul Pino and his staff, and we have done just that. Our community has had to pull together like never before. We have cared for our neighbors who have been affected by the coronavirus, whether they have contracted the disease or lost a loved one. Many of our friends and neighbors lost their livelihoods. While we are not out of the woods yet, I want to thank our community for being there for one another. I'm confident that we will emerge from the pandemic stronger than ever, but there's still much work ahead. For a year, I've been sharing my goals of the week with our residents. It is our way of making sure our community stays up to date on our efforts to keep everyone safe. The number one goal that we have each week is to slow and eventually stop the spread of the virus in our community. Number 2, we will continue to support the Department of Health's vaccination efforts at the Convention Center to make sure our residents are getting their shots. Number 3, we will make sure our residents know all of the vaccination site options in Orange County and how and when they are eligible to participate. We will continue to offer free COVID-19 testing at Barnett Park through the end of this month. So those are our 4 goals for this week. I'm also excited to announce that approximately 50% of Orange County seniors ages 65 and up have been given at least 1 dose of the COVID-19 vaccine. That took about 2 months. Remember, we began the process of inoculating people in our county in December. To vaccinate 50% of our senior population has just been extraordinary. Dr. Pino assures me that the vaccine is now being distributed more widely, more frequently, and will be moving quickly to getting the numbers even higher. Herd immunity is our goal, which is nearly 80% of our population. The governor has signed a new executive order allowing 3 new categories of Florida residents to be eligible for the coronavirus vaccine. They are all K through 12 teachers and staff, sworn law enforcement officers and firefighters who are over the age of 50. Details are still being worked out, but the order will go into effect on Wednesday. That's Wednesday of this week. Our convention center site will comply with the new executive order, and we're happy to hear about this additional expansion. Since the start of the pandemic, there have been a reported 114,434 COVID-19 cases in Orange County, A year ago, few people really believed that we would reach such numbers. We have now seen 1,104 residents who have died from the coronavirus. That is an increase of 13 deaths since our last briefing on Thursday of last week. Our 14-day rolling positivity rate keeps going down. That's good news. It is now 5.49%. Just 4 days ago, it was 6.1%. So that, again, is good news for Orange County. Our Barnett Park testing site will open for the next 30 days. Our health services workers are there 7 days a week from 9 a.m. to 5 p.m. This morning, the appointment portal for the Orange County Convention Center opened at 9 a.m. As of this afternoon, it is still open. So if you're looking for an appointment, please go to ocfl.net/vaccine. Remember that until Wednesday, you must be 65. On Wednesday, that will change pursuant to the governor's executive order. If you do not have a way to obtain transportation to the convention center and have a confirmed appointment, we are partnering with Links to offer a free ride to the convention center. You can access that, again, by dialing 311. An operator will coordinate with Links for the free ride, and there must be a 2-day advance notice. Let me talk a little bit about the FEMA sites, or the spoke sites. On Wednesday, FEMA will open its large-scale vaccination site at Valencia College's West Campus. The site is a federally run site and will operate between 7 a.m. and 7 p.m. 7 days a week. It will administer 2,000 shots a day. Also starting this Wednesday through Saturday, only shots will be given at Inglewood Neighborhood Center in East Orange County, East Orlando. After that, vaccinations will take place in Kelly Park in Apopka March 7th through the 10th. These satellite sites will operate between 9 a.m. and 5 p.m. To pre-register, please go to myvaccine.fl.gov. However, walk-ups will be welcome at those sites. All information is available, again, on the website at ocfl.net/vaccine. I want to talk a little bit now about our Orange County Rental Assistance Program. Our Rental Assistance Program launched this morning at 10 a.m. We have $33 million of federal funds to support vulnerable residents who are at risk of eviction due to impacts or financial hardships associated with the COVID-19 pandemic. As of this afternoon, more than 8,000 individuals access the program through the county's website. Additionally, nearly 940 individuals, tenants or landlords, logged into the application portal, and 369 applications were completed. Interested residents are urged to review program details, as some may not be eligible due to income criteria or physical address locations within the city of Orlando. Mayor Dyer will talk more about the city's program. The city will launch their program later this month, but for the remainder of Orange County residents, they can get information about the rental assistance program by going to ocfl.net/rental assistance. And finally, I want to talk a little bit about our business compliance or strike teams. They have conducted some 9,070 inspections with a 99% compliance rate. Since the citation program began last December, the teams have handed out 143 warnings and 25 citations. This past weekend, I know you're going to ask me about it, so I'm going to tell you about it. What am I going to talk about here, Steve? CPAC. Okay, there you go. One team conducted an unannounced visit to the Hyatt Regency Friday, which was the site of the CPAC convention. They found that the hotel was making every effort to make sure that their guests were following our county-wide facial covering order. Signs were posted throughout the hotel and announcements were made to make sure the attendees were aware of the masking order. However, we know that some of the attendees were non-compliant. But let me just say thank you to the Hyatt team for their cooperation with us. And with that, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings. As Mayor Demings mentioned, last March, fully a year ago, was when COVID-19 first impacted our state and our community. And really, you think about how much has changed over the past 12 months. But what hasn't changed is our community's collective kindness and compassion. We continue to work to stop the spread of the virus. It's also important that we pause to recognize the lives that have been lost from this pandemic. And I have joined more than 60 municipal leaders nationally who are part of the U.S. Conference of Mayors to proclaim today as COVID Memorial Day in our city. Tonight, Lake Eola Park fountain lights will be blue to honor the more than 500,000 lives lost nationally from the virus. And as we recognize this day, we should remember that the victims aren't just statistics. They're people who left family and friends behind. We can honor them by continuing our pandemic precautions to keep those around us and others safe and healthy. Also want to thank our local media for your tireless coverage of the pandemic over the past year. I know it's not an easy task as the information changes, if not daily, perhaps even hourly, and sometimes is difficult to discern exactly what the message is coming from Tallahassee. And there's critical news that needs to get out every single day to keep our residents and our businesses informed. So I want to thank you for your continued partnership in getting the information out about the virus, about assistance programs, and now the vaccine to our residents. As we think about a year of living with the virus, it's also a good reminder to check in with our loved ones, especially those who have been isolated or living alone and can't leave their home due to the pandemic. Our Orlando firefighters continue to work alongside the Department of Health on vaccinating senior residents who are homebound or living in assisted living facilities. More than 650 seniors have been vaccinated, and OFD continues to administer these critical vaccine doses to this at-risk population over the age of 65. And speaking of vaccinations, I want to highlight that veterans under the age of 65 with certain underlying medical conditions and who currently receive care at Veterans Affairs medical centers can receive COVID-19 vaccines at both the Lake Baldwin VA Medical Center and the Orlando VA Medical Center in Lake Nona. I've been working with our Veterans Advisory Council to bring awareness to these opportunities to our local veterans, and also want to thank the VA for their continued efforts in helping our veterans get access to the vaccine. And lastly, I want to update on the City of Orlando's Rental Assistance Program, which will launch with the launch of the county's program today. The city received its own allocation of $8.6 million in federal funding to create a rental assistance program to help the City of Orlando residents who are in need. We are currently working on establishing our qualifying criteria and program guidelines and hope to bring that to our next City Council meeting. And prior to the application period opening to residents, the criterion program guidelines must be considered and approved by Council. So if you'd like further updates on that, go to cityoforlando.gov/assistance. With that, Dr. Pino.
Good afternoon, everyone. Thank you, Mayor. I join you in thanking the press for the coverage and the work and how much you had to learn about all these terms and what it means and the many repeated questions. But you guys are great. You're doing a great job. Thank you. So I'm going to move straight into give you some updates And in public health, you always run the risk to be too optimistic because it can be always something cooking beneath the surface that we don't know about it, like the variance cases that we have. And things could change because there are many variables. But I have to say that the county is in very good shape regarding the pandemic as well as the vaccination efforts. Now, this doesn't mean that we have to, in any way, form or shape, relax what we are doing, because that's what has brought us to this point and will bring us a little bit even to a better place if we continue to do so. But I have an obligation to tell you the truth, and the data is showing that we are in very good shape. And I'm going to illustrate to you some of the data so that you can better inform the public. Of course, death rates, a number of deaths continue to be a concern, and how can you say that we are doing better when we have 13 deaths since we talked last week? And remember, the pandemic data is many data points, and a death is one of those data points, not the only data point. And as much as it hurts, and for those who have experienced this in their families and friends, the reality is they are reducing the frequency. We think that the rates are reducing, and some of the deaths that we have reported this month are actually from last month, as we inform you. Out of the 13 that Mayor just reported, 2 is still from the January review. Our recovery rate continues to be at 96, and our positivity rate for the last 14 days is 5.9. With regard to the vaccines, let me give you quickly that we have vaccinated, or we have given 239,290 dosage of vaccines in our county. To county residents, 204,040, and for over 65 county residents, 51,900. Our population for 65 and over is about 160,000. 160,000, yes, that is 160,000. So for resident that has received at least one dosage, it is 80,301, and that is 49.7% of the 65 years and older estimated population. With regard to the executive order, the mayor mentioned the new groups that are going to be able to get into the vaccination site. That will be for both the federally run and for the Orange County Convention Center. And it's going to take us a couple of days to fix the website to eliminate the filter, because it's a filter there for 65. We are going to open that up. Remember, for the general public, continue to be 65 years and older. And for other groups, we are going to move into 50 and older. That include teachers K to 12 and other employees in direct contact with the students. It's going to be for healthcare workers with direct personal contact, for law enforcement over 50, and also for firefighters. But the firefighters are EMS providers, also certified EMS in our county. So in that case, we also will open up to any EMS of any age that is part of the executive order that the governor put in place before. Can we take a look at okay. Here is supposed to be a map. It's not working because it looks like the computer may be missing a driver. But this is our epi curve. And as you can see, it's clearly going down dramatically, the number of cases. Now here today, we only have a little bit over 100 cases. And we think that it could be a lag in data here. It's too low for one day, and I will be surprised if tomorrow we don't see a higher number because of delay in reporting. We checked the data, and there are approximately 4 labs that normally report to us that didn't report any cases yesterday. That's a little bit strange. It could have been, but we'll see what happened. But anyway, it continues to decrease, and even if the numbers are that much higher than yesterday, it will not get to this level. It will be lower. Next. In this tab, those are the variant cases by day, and as you see, we have increased to 17. Next. Now, these are the death per day. And if you can see, we clearly has been decreasing the number of deaths that we see daily. And this is also by age group, how many deaths for each of these group. Of course, the older the population is, the more likely they will experience negative health outcome. Next. Now, this is our age by day, and these are the number of cases by age group. Next. This one is, demographics. And although that data is not very well clean, and we may not have the ability to do so back reviewing the data that has been assessed because of the multiple sites. And sometimes some of the sites are not entering the data correctly, although we are insisting to many sites to do so. Next. Now, this is the positivity rate for the last 14 days. In the blue, you have the days. In the red dots, you have the average positivity rate for the last 14 days. And you can see a slow decline, but constant decline in positivity rate, even by day, but also by the 14 days. And these are the number of cases per week of the epi curve. Next. Now, this is an interesting data. This is long-term care facilities. These are the percentage of people in long-term care facilities that are COVID positive. It's below 1% right now. It was up to 2.4%, I believe. And here you have number of residents and number of staff with positive COVID cases. Also, a significant decline in long-term care facilities. Next. This is our curve for 5 to 17 years old. We have seen also a significant decline in the number of cases and in school-age children. It doesn't mean that they are in school, because it could be also private schools or other type of institution. It doesn't mean that they are all Orange County public schools. But the positivity rate among children 5 to 17 has also, per 100,000 cases, has also significantly decreased. Next. And this is our hospital data. You have in green the total number of hospitalization, the total number of people in non-ICU beds, and here you have the total number of people in ICU beds. And here are the data. And right now, we have about 26% of capability in hospitalizations open. And this is even with elective procedures. We have about 170 beds available in ICU. And, we have 776 ventilators, as well as look at the number of people hospitalized. In total, 180 for 444 that we have in January 16, I believe it, or 26. I don't see the number right there. But the decline has been significant. We don't need to see the last one. That's just a document. So with that is to say that between the steps that we have taken, the time lapse since the overlapping holidays that we have, plus the measures that the county and the public has taken us, have brought us to this point where we can clearly say that we are in very good shape. We just have to be extremely careful how we proceed in the future so that we don't commit the mistakes that we have done in the past by relaxing ourselves, traveling too much, or going to parties. That continues to be an issue. With that, I will answer any questions that you may have. Thank you.
Just as a reminder, we have Orange County Commissioner Wilson, who has joined us, Orange County Commissioner Maribel Gomez-Cordero, who has joined us. We have Mr. Tim Boldick from our compliance, our strike teams that's here as well. And we have Mr. Scott Howard from Orange County Public Schools. If there are any questions in Spanish, we have the ability to translate here as well. And so with that, we'll open it up for any questions at this time.
Lauren Seabrook, Channel 9. My question's for Dr. Pino.
Yeah.
Sorry, Mayor. Dr. Pino, I'm wondering, after the governor made his announcement today on things changing, one of the things I saw a lot of people say is that they didn't feel like it was broad enough age-wise, especially for teachers. They felt like it should be all teachers. In preparing for this change, has your staff identified maybe how many people this particular 50-plus category for teachers, fire, and police officers may be in that category? Like how many people we're talking about?
So the schools have the answer for that, but with regard to the numbers are opening, I think that what the state is doing is actually wise by going by age because what you don't want to increase is the bandwidth of the people that can come and that we cannot offer those services. I think it's a correlation between the inventory of vaccines and the number of appointments open. Now, we have reached about 50% of the 65 years and older, and what other counties have experienced is when you hit 50% of a specific population, kind of slow down because you have gotten all of those that have the first half that really want the vaccine. And so there are other groups that will make a little bit longer to make those decisions. So with that, the numbers are in the thousands for the schools, and Scott Howard can talk about these numbers, and for the different municipalities with EMS and law enforcement. Those numbers are in the thousands. Scott?
Thank you, Dr. Pino. Right now we're at 9,542, so 9,542 would be eligible 50 and over. Mm-hmm.
Amanda Dukes with Channel 2. It's for Dr. Pino. Dr. Pino, the Johnson & Johnson vaccine got its approval this weekend. When will we see that coming into play here in Orange County? Because it's going to be a different procedure with just one dose.
Probably this week.
Is that going to change how you do things at the convention center? Is that where it'll be?
The convention center, so you ask county. So the county will see the vaccine this week. Okay. The convention center is not scheduled to receive that vaccine yet, as of yet. So strategically, you want to use that type of vaccine in places that you don't want to go back to. Because you have to schedule. For example, a good place to use that vaccine would have been assisted living facilities. You go once, you do everyone, you leave, you don't have to come back. Although we have done many of those already, the state have done. But the type of populations that you don't want to have to go through the second doses. But the vaccine is going to be very useful in speeding up the vaccination rate, again, as it's one dosage. As you give it, people don't have to come back. And it's just another tool. It adds flexibility because of the temperature that doesn't have to be controlled. It can be a regular freezer. So it adds a lot of flexibility to the fight that we are engaging.
Emily Braun, News 13. This question is also for Dr. Pino. Dr. Pino, the governor also addressed people with severe underlying health conditions if they provide a doctor's note to be eligible to receive the vaccine. But at this time, is that just for doctor's offices and pharmacies, or could they bring that doctor's note to state-run sites as well?
I'm sorry, could you repeat the question?
Yeah, so the governor also addressed people with severe underlying health conditions that make them high risk. If they have a doctor's note, they could bring that and be eligible for a vaccine. Does that also apply to the state-run sites, or is that mostly going to apply to, their doctor's offices or pharmacies who are administering it?
So the Orange Convention Center site is not designed really for people with a pre-existing condition that have to demonstrate that that pre-existing condition exists. Because what happens with a site is that even if you stop one vehicle, it creates a domino effect into the entire operation because it backs everything. So we are trying to divert to that site those who are a speedy process that can quickly go through the process. Now the new order from the governor said that the Florida Department of Health will be releasing some guidance on what the document have to say. So we haven't seen that. That may help to clarify the process and how easy we can do it. Maybe if we have a standardized form that people can show with identification information, it would be a lot easier, and we probably can do it that way. But waiting for additional guidance from the state on that.
Dr. Pino, don't go too far. The next question's for you. Nikki Zizaza with News 6. Mike, you mentioned that at the convention center, when you guys move to this priority group, it's going to take several days because of the filter. For people at home who hear, I qualify, I should be able to come in and get it, they want to know, when am I going to be able to get online and do that? So right now, what needs to happen for the site to get where it needs to be so that, a 51-year-old teacher would be able to get that shot?
So the order say that we should be ready by the 3rd, and the 3rd is in 2 days, and we must be ready by the 3rd. So the site will be ready by the 3rd. That is Wednesday, Monday. What the vendor is doing, and that vendor is not only a contractor, it's also the contractor for the state and other counties. That's CDR McGuire Health. And what they have to do is they have to recode and program the website so that it takes off that filter. They told me that this afternoon I will be able to receive more information exactly when it's going to be clean, the site. But my advice to anyone who qualifies is to pre-register. Go through the process. You don't have to get an appointment. Go through the process, register yourself into all the information. When it opens, potentially on Wednesday morning, you just have to click and make the appointment. It will make it a lot easier. We will announce in the county and us simultaneously when the site becomes ready for this new age group.
Buenas tardes, Félix Pirela de Telemundo para el doctor Raúl Pino. Doctor, quisiera para nuestra comunidad hispana que está a esta hora en sintonía de Telemundo que nos explicara cómo y cuándo va a comenzar a funcionar esta orden ejecutiva del gobernador de vacunar a los policías, maestros y bomberos de más de 50 años. Y por otro también escuché que van a habilitar también pronto los puntos satélites de vacunas para ayudar a las personas desatendidas. Sabemos que muchas de nuestras comunidades se les dificulta hacer una cita por internet, teléfono. ¿Cómo van a funcionar esos puntos satélites de vacunación?
So the question in Spanish was to explain how the federally operated site is going to work with the spokes, and also how we are going to work with the new the executive order from the governor. Let me explain one thing in English first, and then I will add it. With the federal site, it's important to know that it's going to be a fixed site at Valencia West. That's going to be a fixed site there. And then from there, they are going to have the sites that the mayor talked about, spokes, that are going to concentrate in areas of high social vulnerability index. So areas that we have seen a lot of poverty, socioeconomics, lack of transportation, places where residents of minority descent live in large numbers, areas that we haven't been able to get to. That's the intention of those spoke sites. And that also is going to have a group of individuals that are going to go out to the surrounding communities of the spoke sites to try to bring people into the appointments. And again, it's going to take walk-ins, so anyone can walk to any of the two sites and just register right there and get your vaccine there if they have the ability and capacity for that day. Just explain that in English because I hadn't had the opportunity to explain that piece. En español, lo que va a suceder es que con el sitio federal va a estar en el oeste, el campo oeste de Valencia College, y de ahí van a ser 2,000 casos en ese lugar, y también van a tener diferentes satélites que lo vamos a anunciar cada semana, donde la comunidad también puede ir a hacerse la vacuna. Los dos sitios, tanto los satélites como el sitio fijo, van a aceptar people que vengan sin citas. Y se pueden registrar allí mismo, las vacunas son gratis y no hay que pagar absolutamente nada. Pero también siguen las instrucciones del gobernador con respecto a la edad de las personas. Y entonces eso va en lo que me preguntaste. El gobernador hoy ha dado una orden ejecutiva que modifica la que existía anteriormente, que mantiene que continuamos vacunando a la población en general que tiene más de 65 años, a todos los trabajadores de salud que tienen contacto directo con pacientes y también a los servicios de emergencia. A eso el gobernador ha añadido personas de más de 50 años que son bomberos, policía o en las fuerzas policiales en general y también a los maestros de kinder hasta el 12 grado que tengan contacto directo con los estudiantes. Esos grupos se van a añadir. Le pedimos a las personas que se preregistren en el sitio si se quieren poner la vacuna con nosotros, porque de esa manera solamente cuando abramos para los más de 50 años, solamente tienen que hacer un clic, coger el appointment y todo está hecho. ¿Responde eso a tu pregunta? Debe ser el día 3, el miércoles, en la mañana.
Hi, Robert Guadarrama, Fox 35. Mayor Demings, come on down. Let's talk about CPAC. Did your strike team say how many people were found to be non-compliant with the mask mandate, or was it too many to count? And also, in their conversations with the hotel staff, did they get the idea that they were kind of meeting some tense conversations with people trying to get them to being compliant with the mask mandate?
I'm going to ask Tim Bolduc to just come on down. He'll address it, but about what they specifically saw there. So rather than me get into it, I'll let him do it. Tim?
Yeah, our teams were out there on Friday, unannounced, and we met with the people at the Hyatt. The Hyatt did a really good job in terms of, I don't think people realize that a lot of these events that are happening, they submit plans to us with regard to a COVID safety plan is what we call them. We're looking to make sure that they're meeting all the mandates and the sanitizations, the signage requirements and so forth. The Hyatt provided that plan, and when we were out there, they were following that plan. Certainly, every once in a while they would see somebody without a mask. I think it was generally in the news platforms, the ABC, CBS, Fox News, and so forth, when they're doing an interview with a politician and so forth. Although they were kept in a certain distance apart, they were not masked. We didn't see that as an issue as long as they stayed within that boundary. But overall, I think the Hyatt did a really good job of making sure that they adhered to it. They did their announcements, and they had people walking around asking people to mask up if they didn't have a mask on.
Danielle Lama with Fox 35. This question is for Dr. Pino. Just following up on the question earlier about people under 65 who have medical conditions, the governor's executive order says that physician determinations shall include a statement that the patient meets defined eligibility criteria established by a form prescribed by the Florida Department of Health. That's the one you guys have not seen yet. When do you expect to get that, and what do you think it'll entail?
I don't know the answer to any of those. I hope that soon, and I don't know what the content is going to be.
Steve Hudak from the Sentinel, and this is for Mayor Dyer, Mayor Demings, and Dr. Pino all together. When you saw the crowd from CFAC on television, I'm assuming you saw it during the former president's speech, what did you think? Since most of them didn't appear to be wearing masks.
I actually concede I didn't watch any of it.
I'm going to say I didn't watch it either, but I was told that there were a number of people who chose not to wear facial coverings, and they did so at their own apparel. So.
I didn't watch any of it, and But I got a lot of texts from friends and family from across the country telling me how bad my job was, that people were. So.
This next question was texted in from Rebecca Turco with News 13. It's for Mayor Demings and Dr. Pino. Do you have any updates on the upcoming federal vaccination site at Valencia College and the FEMA mobile sites? Is the county affiliated or involved in these sites at all?
So different than our site is operated by the Department of Health. That site will be operated by the federal government and the Department of Emergency Management. But we are working all for the same goal. So they have our full support. We have been involved in calls, in planning, and everything else. And actually, their vaccines are whole in one of our facilities with the county refrigerators. So if that tells you about how we are collaborating, that's the way that we're doing it. And I have to give it up to the county because we called for help, and immediately we got the fridge that we needed. The room was painted, clean, everyone set up, and it was ready to receive the vaccines today. Those 20,000 vaccines for this week are here.
For you, Dr. Pino, as well, unless Mayor Demings, you wanted to add?
The only thing that I would add is that it is a collaborative effort. Obviously, there has to be communications from the federal government to the state and to the local. Obviously, the site at Valencia is in the city of Orlando, so it does impact the local law enforcement agency, the Orlando Police Department, and then the spoke site that we chose, the first one that will open, is in the city also at the Inglewood Center. Again, it impacts the city of Orlando directly, so there has to be a coordination, and there are paramedics on standby at any of these sites, so it impacts the local fire departments. And then towards the end of the week, we will transition with the spoke site coming off of that primary FEMA site at Valencia. We have a spoke out in the Kelly Park area in unincorporated Orange, and then that will impact Orange County paramedics and others in that process. So it is a collaboration is the point that I'm trying to make.
Thank you. This next question is for Dr. Pino from Hadass Brown from WESH. UCF announced today that they plan on a full return to face-to-face learning for the fall semester. This means that capacity restrictions would be lifted. What is your take on this? Is the plan safe?
Listen, I'm an optimistic person. I think that in the fall we will be in much better shape and probably close to back to normal if we continue with vaccines and the virus doesn't give us any surprises. But it's very difficult to predict that far.
This is the last one for you, Dr. Pino, from Melissa Thomas with Florida National News. Question reads, the governor has authorized people in more healthcare professions to administer the vaccine, but we noticed that I'm going to say this wrong. Those that take our blood are not mentioned. Are they also authorized to administer the vaccine?
Oh, the phlebotomist. So people understand a scope of practice for each profession is very clearly delineated by law. Who can do what? And it sounds silly at times. For example, our dentist, one of our dentists cannot give vaccines. It's not in the scope of practice for dentists. Although that dentist can give injection, anesthesia, and other things due to their procedures. So I don't have an answer for that. It's just the way the law is. And it's not a Florida thing. It's all over the country. It's the same. Positions delineate what can be done by each position.
This last question is for Mayor Dyer and Mayor Demings. It comes from Ryan Lynch in the Orlando Business Journal. It reads, what demand do you expect for the rental assistance program compared to earlier in the pandemic? What are you seeing?
We suspect that as time has gone forward, there's still a number of people who are unemployed or underemployed, and so over time, the arrears in rent payments have continued to grow for some. So we have no way of really knowing in advance precisely what the demand will be, but suffice it to say that as we go forward, that demand will continue. So we'll just have to see. But fortunately, we do have $33 million to allocate, and individuals who find themselves behind on rent payments can receive up to $10,000 in payments to assist to bring them up. The goal is to keep them in their homes and not create homeless individuals or families.
So in this instance, we need to be clear, City of Orlando residents are not eligible for the county rental assistance, and the city has received $8.6 million in money to use for rental assistance for people that live in the City of Orlando. Our prior rental assistance program had been related to the Downtown Business District, or the CRA, so that's where those funds came from. But I anticipate, like Mayor Deming, substantial need out there, and we don't think we're going to have any problem being able to allocate the $8-some odd.
Okay, I think we have covered all of the questions at this point. Thank you all for being here. Our next press briefing will be on Thursday at 4:30 p.m. We'll see you then.